to another week of the RevMD podcast. I'm your host, Dr. Heather Signorelli from National Revenue Consulting. And if you guys haven't been listening to our podcast for long, just to remind you, we are a full-service medical billing and coding company based out of Denver, Colorado. And we help physician practices with a reliable and data-driven medical billing service. So we help practices really understand what's their current process, what's the metrics we should be using, what are the benchmarks we should set in place so that their revenue grows sometimes by up to 25-30%, depending on what's going on with the practice today. So if you are looking for a new service, head over to our website at nationalrevenueconsulting.com and learn more about our services and read testimonials from our current clients. All right, back to the show for this week. And I started this week with actually asking our team of billers and coders about what they see as a common reason that impacts practice revenue. And they said unanimously, it all comes down to documentation. As they review AR and denials, documentation is top of mind and one of the most controllable and impactful things in a medical practice that can impact your revenue growth. So today we're going to dive deep into the golden rule of medical billing, which is the importance of having appropriate documentation in your medical records. And this is going to be something that impacts both the healthcare team members and patients, right? It's not just about getting the bills paid, it's also ensure that you have high quality of care and patient outcomes. And so it's all connected. And while we definitely focus on the revenue growth, we all recognize that this impacts patients as well. We all learned in medical school that the golden rule of medical billing is quite simple, but it is essential. And that is, if it's not documented, it did not happen. And in other words, every medical encounter, every procedure, every service that is provided to a patient needs to be accurately and comprehensively documented in the patient's medical records. And it's crucial because it does impact the entire revenue cycle, really from the moment the patient is seen by the healthcare provider. And actually, even before that, when the patient is calling into the office and getting their appointment scheduled, they're getting their demographic information taken, they're getting their insurance information taken. Every single piece is critical when it comes to accurate documentation. Today, we're really going to focus on the other side of it, where the physician is seeing the patient and they're really making sure that they're documenting medical necessity so that it helps provide that foundation for medical coding, accurate billing, and successful insurance claims. When the documentation is incomplete or it's inaccurate, it's going to lead to claim denials, delayed payments, and potentially even legal and audit issues. So some of those consequences that can happen when there is insufficient documentation really is all about this claim denials. And that's what our team is seeing, because insurance companies are often going to require specific information to process the claims. And if that information isn't there, the claim is just rejected. And what happens on the front end is if we're not getting that demographic information, the insurance information accurate, that's where the claim rejection comes from. But then on the back side of that, if there isn't this story around medical necessity and you're doing procedures or you're dropping more complex CPT codes and the insurance companies flag the claim for medical record review and they get those medical records and they don't see that story, they don't see the medical necessity provided in the clinical documentation, that's where they're going to shoot off a denial, and they're going to really the office and the billing team isn't going to have a mechanism to stand up against that denial. And so today we're going to talk about some of those example situations of missing clinical information that impacts medical billing. But I'm going to tell you the most important thing is thinking about your medical note and thinking about telling that story, right? So if you are doing a procedure, if you are documenting a higher level E&M code, really what's going on with the patient? What are the multiple, diagnostic conundrums that you're working to figure out? What are the patient's symptoms? Why are you doing a procedure? What are you hoping to find out from a test or a procedure? What's in your diagnostic purview in terms of what are you trying to differentiate between. And then when you do the test, especially if you're doing the test in the office that day or an ultrasound in the office that day, what are you seeing? What did you see that leads you to change your management or rule something out, right? Sometimes we do tests and ultrasounds that aren't necessarily to change management if we don't see something wrong, right? So you got to tell that story. Okay, I didn't see X, Y, and Z, so we're going to continue with our current treatment plan, or we're not going to have any other concerns regarding our current treatment plan. You've got to start telling that story. So again, all about telling that story within your medical documentation. So now I'm going to give the top 10 areas of missing clinical information in a medical chart that can impact medical billing. So first and foremost, as I brought up, incomplete patient demographics. So if the patient's demographic information, and we're talking about name, date of birth, insurance details, or contact information is missing, or it's incorrect in the medical chart, it's going to lead to billing errors and rejections. And this is the most of basic things. Number two, which we do see, especially when we are getting requested for our surgery records, is missing or illegible physician signatures. Now, I know personally my physician signature is terrible, but we do recognize that when you're signing something that may be sent off to an insurance claim, it's really important that the physician signature is on the medical record so that if claims are requested to have medical documentation sent in, then they can see that it is signed off by a physician. Number three is inaccurate patient history. Now, if the patient's history, including any pre-existing conditions or allergies or past treatments, is not adequately documented, it can impact the accuracy of the diagnosis, the treatment codes that are used for billing, and potentially lead to denials that we're going to have a hard time fighting. So again, it's all about the story. Number four, and what I mentioned before, and probably one of the most important, is a lack of detailed clinical notes. And I get it. These are hard to do. You've got limited time with the patient. You're trying to get everything crammed in. You're trying not to deal with notes at night, which I fully support. But detailed clinical notes are just going to be crucial for justifying the medical necessity of any service you do. If these notes are missing or lack essential information, the companies are going to ask for medical records and they're going to deny the claims due to insufficient documentation. And there's just no way around that. And so if you're thinking to yourself, gosh, I don't know if my medical documentation is up to where it should be, this is where a coding audit is really, really important. And coding audits can be one of the most insightful things you can do for your practice and really should be done on an annual basis. So if you haven't had one in a while, reach out. We're happy to connect you with one of our certified coders, and they can do that along with education for your team. Number five is incomplete procedural and diagnostic codes. So obviously proper coding is vital for accurate billing. We all know this. But if the medical chart does not contain the necessary diagnostic codes and procedure codes, then we're going to have issues with the claims that are going to get rejected or reimbursed at really a lower rate. And so basic 101. And again, those ICD-10 codes, you're again trying to tell that story. So if you had a medical documentation that outlined kind of what happened with the patient, what you were thinking, make sure that those diagnostic codes are also put in the billing claim itself. So super duper important. Another thing we see is missed documentation of time-based services. So sometimes you may be billing based upon the time spent with the patient, but if the medical chart fails to document the time you've spent, it can lead to underbilling or denials. And I really discourage against the rounding up of, 45 minutes every time it was 37 and you round up to 45. Really try and put the exact number of minutes that you think you spent with the patient in those activities. Number 7, incomplete progress notes. So this is really just about, did you finish the note? Are they signed off? Is it complete in the medical chart? Right? So it's really important that all of those progress notes are finished, the patient's condition and the medical service provided are outlined, because this can also really result in claim denials. And so that's why for our team, we really wait for those doctor's notes, for the progress notes, for, the EMR, everything to be signed off, completed. And while for a lot of our teams, we try and ask for the physicians to do that within 24 hours, we recognize this can be challenging. But if those aren't done timely, then you can run into issues where timely filing becomes a concern, because if they're not updated daily, signed off so that we can get them out the next day, then it does impact workflow. It does impact efficiency. And if they take months to sign off, it can impact timely filing denials, because some insurance will say you have 30 days, you have 60 days, you have 90 days to get that medical record to us. And if you don't, then it's too bad, we're not going to pay you. Now, Medicare gives up to 365 days, but some insurance companies do much shorter than that. So important to get those progress notes signed off timely. Number 8, lack of supporting documentation for medical records. So this goes back to specifically around medical procedures that are performed, telling that story, right? Why am I ordering this? What am I thinking the diagnostic differential is? How am I going to decide on that? What did I see if I did the procedure that day and in the office? And what did that rule in or rule out? And how is that going to change my management or not change my management? Tell that story. Just like if you were, a resident in the hospital signing off a case to an attending, got to tell that story. This is no different. And I know it's time consuming. And that's why a lot of, see some practices getting scribes or even AI scribes where it's not actually a human. And I think there's some work to do around that. We're testing out some AI in our own company, and it's hit or miss on how good it is. But there are options out there to help your team members with regards to documentation and signing out your notes timely. Now, number 9. This is an important one. Missing referral or prior auth information. So you really have to have a policy for the front desk to understand when they need referrals or prior authorizations so that they get all of those done prior to certain medical procedures. Because in the absence of this, you're going to get a denial and you can't go back on that. So it is just too late. Number 10, incomplete discharge summaries. So if you do have a hospital care claim or a procedure that resulted in a hospital admission, you've got to make sure that there are thorough discharge summaries. And that includes the patient's condition at discharge, follow-up instructions, and really any necessary prescriptions. So again, this is all basic common sense. And I know as time crunch happens with, how fast patients need to be seen, it gets harder and harder to do this. And that's why really encourage looking at, scribes, whether that's onshores or offshores or AI technologies, to really see if you can get those clinical documentation notes firmed up, really outline what's going on with the patient, be very detail oriented because it's going to impact your revenue. And last, I'm going to emphasize that the most common denials that we see and that we really have a hard time fighting is all about documentation in the chart, right? What ICD-10 codes were dropped? Were they documented in the medical note? What procedures were done? Were we telling that story of why we needed to do the procedure, what it led us to think about in terms of how we are going to change management? All of that stuff needs to truly be detailed out into the health note. And last but not least, we don't want to forget about the patient's perspective. We all understand that inaccurate documentation is going to impact the quality of care, because if somebody transfers or they get seen by a subspecialist and we don't have the notes documented of the things that we've done for their care, that's going to make it more challenging for future physicians and healthcare team members to see those patients and understand what was going on, why it was done. And so again, while we really want to talk about and focus on the revenue growth, we certainly recognize that clinical documentation is going to impact patient care as well. And so in conclusion, that golden rule of medical billing straight from the mouth of the NRC billing team is if it's not documented, it did not happen. And while this is a fundamental principle, it does impact both healthcare provider and patients. It impacts your revenue. And so I really encourage 2 things. If you haven't had a coding audit recently, get one done. And last, complete documentation in your medical records, because that's going to impact your ability to have claim denials fought, medical records sent in, and showing why you did something. I know it's a lot of work, but it's super duper important. Again, I hope that this golden rule of medical billing is helpful and just a good reminder of the importance of getting accurate documentation in your entire process for your patients in your office is going to be something that you focus on for the remainder of 2023 and beyond. I hope this podcast was helpful. And again, if you are looking for a new medical billing team, head over to our website, nationalrevenueconsulting.com. We do have a free self-assessment tool that talks about metrics, so you can kind of get a glimpse into what's going on in your own practice. And we shoot back tips back to you, kind of giving you some ideas around what you can do to improve things. All right. Have a great rest of your week.